of its political structure. All right. So as well, I want to point out something here in new cases. This is very troubling, I think, because it sort of picks up and builds on what the WHO has done, which is seemingly being more concerned about stigmatizing people, upsetting them, hurting feelings than tending to what we would call public health. So the number of coronavirus infections in the Netherlands has risen to 24 reports, RIVM, I guess their equivalent of the CDC. 6 new patients on Tuesday, all of whom are in home isolation. So that's not always a good thing, I don't think, necessarily. All of the people diagnosed with the virus have recently been to northern Italy. So Italy is just this super spreader, I don't know what's going on with that particular virus up there, but it seems to be jumping very easily. RIVM will no longer announce where patients come from or where they stay. That's no longer is going to tell anybody in the general public where patients come from or where they're staying. And that's essential information. I like how Korea is doing this, South Korea is doing this. You got to tell people precisely where are the infections, who's been contacted, all that stuff, and that gives private citizens the opportunity to react and adjust. So if you told me right now that there's a patient, there's a case that we just found, and they were at the movie theater downtown, I'm not going to go there. But RIVM is solving for some other thing besides what I consider to be the core tenet of public safety, which is people need to be armed with the best possible information. That's what we're doing here, arming you with the best information we can. I disagree with this very strongly, no longer telling where patients come from or where they're staying, because this thing has jumped out of quarantine more places than I can count right now. It really has. And so when we consider, this is the same text from prior page, look at how the World Health Organization is approaching this. They say when talking about SARS-CoV-2, certain words and language may have a negative meaning for people and fuel stigmatizing attitudes. Here they are, they're worrying about feelings more than they're worrying about getting the health aspects of this right. I just couldn't disagree with this anymore. I just couldn't. These words and language can perpetuate negative stereotypes or assumptions, strengthen false associations, and other factors create widespread fear or dehumanize those who have the disease. I'm not so sure about that. I think that it's when you have a disease, it's pretty important to know who's got it and all of that, because that's how does social distancing and isolation work if you don't know from whom you want to socially isolate or distance. It looks to me like we've got a PC culture run amok. I think that when I said R naught is a function of the virus times whatever culture you've got going, the PC culture is going to turn out to be a not dominant, not strategic, not very solid way to go about this, because it's just data. If the facts hurt you, the problem isn't with the facts. These are facts we need right here. And which is who's got it, where are they, and how do I avoid that? As this person replied in response to this tweet over here, the virus doesn't care about feelings, doesn't care about stigma. All it cares about is a willing host and complacency. I agree, Doug Jones. You got that one right. So as we go a little bit further, here's a consequence, I think, of, no longer announcing where they come from and worrying about how people are, feelings are going to play into this. How about this? So this again, in the Netherlands here, Red Cross Hospital announced a temporary admission stop for the intensive care unit on Monday evening. A patient who was admitted there on the 20th of February was later tested positive for the new coronavirus in an initial test. A second test still needs to be performed. Patient currently is in isolation. This is the third hospital that temporarily can't accept new patients because of the virus, at least in intensive care. So what's happening here is that an already thinly resourced and stretched hospital system is now finding whole parts of them shut down. This is absolutely not what needs to happen. And of course, this happens best in an environment of secrecy and a lack of transparency. So if you're not going to say where they're coming from or all that other stuff, don't be too surprised when they get admitted to a hospital and then, oops, now we have to shut the whole thing down to decontaminate it. And that's not even remotely what we want to see happening in this particular case. So let me agitate again one more time for transparency. Transparency, transparency. We need all the data. Just give it to us. We can manage it and our feelings won't be hurt. Don't worry about it. All right.